All right, welcome to News Talk with Brandon and Bob. I'm Brandon Jones. This is Robert Herriman.
Nice to see you again.
Editor-in-Chief, Outbreak News Today, the worm and germ guy himself.
Worm and germ guy.
Yes, as he's affectionately known by some.
Affectionately, Pops.
Yes, indeed. Pops on pop culture, amongst other things. So we're going to jump right in. Obviously, COVID has taken over the headlines again in many, many circles, and Anthony Fauci at the top of that list, where he has flip-flopped within weeks. It seems like 1 week he'll say one thing, another week he says the other, and he came out about masks and that kind of thing. You want to speak a little of that? You want me to go ahead and read what the article actually says here? Yeah. So this was a quote from him. Basically, the masks were not advised from the public when they were originally done, and he had basically come out and basically admitted that because we were concerned about PPE shortages, mask shortage, if we told people the truth that masks were beneficial, the people would buy all the masks, and then we'd have a faster shortage. So he basically confessed to this. He was speaking with The Street. He says how effective masks are. He says, quote, "Masks are not 100% protective. However, they are certainly better than not wearing a mask, both to prevent you, if you happen to be a person who maybe feels well but has an asymptomatic infection that you don't even know about, to prevent you from infecting someone else. But also, this is the important point, it can protect you a certain degree, not 100%, but protecting you from getting infected from someone who is either breathing, coughing, sneezing, singing, or whatever it is when droplets of aerosols go out. So masks work. It is important to actually the important thing is actual physical separation. So, of course, now he's gone on the learning curve. Well, that was actually later. So before I get to there, so he acknowledges that the masks were initially not recommended because of first responders. So he says that the health experts were concerned, the public health community, many people were concerned at that time when personal protective equipment, including N95 masks, surgical masks, were in short supply. So basically they're admitting that we didn't want to tell you that you could not only not infect someone else, but you could actually reduce the chances that you would get infected by wearing a mask, because people will buy all the masks.
Yeah. I'm glad they finally came clean. I was looking for a video I did a month and a half ago or so saying that the CDC lied about this when they came out about that, because common sense dictates that any kind of coverage has to help a little bit, right? And I knew that was the reason why they were doing it, because of the healthcare workers. However, the problem is you can't be lying to the public, because the public is already on shaky ground with public health as it is for a number of reasons, and this is not helping things. So, yeah, and Fauci, like you said, has flip-flop on a number of things, but I do appreciate that he's come out and finally acknowledged it. I haven't heard the CDC acknowledge the fib.
Fib, you're so nice. I purposely put this will say Fauci lied, people died. Yeah. Like you basically are contributing to the fact that people were like, well, I don't need a mask, we won't buy masks, we won't, or they'll buy, well, we'll use bandanas and we'll do whatever, and you're like, okay, what? It doesn't. I could have bought a mask a week ago. Why didn't I just buy a mask?
And the thing is, yes, the PPE situation was much more dire back then. And I think if you were just honest with the public, there's probably a lot of people that just would have said, okay, let the healthcare workers get it first, and let's ramp up production and get it out to the public. But
couldn't you have had businesses just pull it off the shelf? If you were so concerned you'd be short, you'd be like, all right, listen, we're going to have to pull them off the shelves, make sure the staff have them, and then they'll be in production. The other thing, too, that I want to add to this, too, make sure that you correct me if I'm wrong, because the initial emphasis was put so much on shifting resources to making ventilators instead of masks. So we told all these businesses, rework your entire factory, try to do all these things, let's just make ventilators, spend all this money buying ventilators, transforming things that would work in that capacity because of the fear of so many people having to be on that element of life support and not masked. So to me, that factors into it as well, where we also were not even focusing on the right element of resources, and now we have a plethora of ventilators, and the mortality on a ventilator is awful.
Yeah. And again, there is a learning curve here, and they are learning a lot. So naturally, mistakes are being made, but it still boils down to the lie. That's just what gets me the most.
Let me double down on how bad this gets.
And I really wish I could find that video, because I stated this quite a while ago.
He just doubled down on this. So this literally was in my notes prepping for this conversation. And he just did an interview with the Health and Human Services podcast called Learning Curve on Wednesday. One of the problems we face in the United States is that, unfortunately, there's a combination of an anti-science bias that people are, for reasons that are sometimes inconceivable and not understandable, that they just don't believe science and they don't believe authority. He goes on to talk about science is truth and evidence. Okay, you just lied to us. You just admitting to lie to us. You have flip-flopped over and over and over again, and we're supposed to still be like, you wonder why this sentiment is not, first, that not only existed, as you're bringing out, it has gotten so much worse.
Yeah. And any serious topic that they bring up from now on is going to be met with skepticism amongst the public. And, and I said, I think it was on our first show, that Dr. Anthony Fauci is the consummate politician / bureaucrat.
Yeah.
He sure is.
Yeah, it's brutal.
Yeah. But yeah, it's really a shame that you can't have any faith in the public health community, because so many people are really relying on it. And I think it's getting damaged.
Okay, so let's review for people to understand that a mask that is down here isn't doing anybody any good. It's not doing yourself or anybody any good, right? It has to cover both your mouth and your nostrils, right? And when I sneeze and I'm in a mask, I'm at least reducing the distance that any particle could get through, and it would possibly propel, let's say, 2 feet instead of, say, 4 feet. I don't know, whatever the distance is.
I mean, there was a study that came out earlier this week where they were testing sneezes and hard coughs in a mask, and they did find droplets that could go. Of
course, it can. Feet, there's no way. It's going to be individuals, right?
But it does reduce things, and it's not going to prevent everything, and nobody's ever said that.
Right.
I mean, so, you have an N95 mask, that's one thing.
But that's the premise of you're wearing the mask, I sneeze, it's reducing the distance. Now, how is you wearing your mask helping prevent you? Is it just the chance that droplet lands on your mouth or your nose?
It just reduces it even more, but the primary reason is for the person that may be infected.
Mm-hmm. To be sneezing and coughing particles.
Preventing those droplets. Remember, this is, some of the studies are kind of iffy on this, but it's primarily droplet transmission, not so much aerosol. Would be something where I would sneeze and it would linger, like measles, and it would linger in the air for an hour or two or whatever.
It stays in the air.
Yeah.
This is not like that.
The droplet's too large, so it does drop almost immediately.
So imagine gravity, folks. So when you think about something being airborne, think about something that you see in a lot of science fiction movies and action thrillers where people are putting something in the air and it just stays in the air and gas. You don't see it, but people breathe it and they're infected. Whereas this is more like the droplet. It is prone to gravity, so it's going to do whatever and just fall basically on that, right? So that's kind of, so your mask, you're wearing a mask hopefully over your nostrils and your mouth to prevent the distance or how much can escape. Yeah. Then you wearing the mask could prevent you getting sneezed on. But that is significantly less in the grand scheme of things, I guess.
Secondary.
Most of that's going to be you get it on your hands or something like that, and then you put it in your face, you put it on your mouth.
Well, yeah, and that's true of almost any kind of respiratory disease, colds, flus, or anything, is touching something, having that contaminant on your hand, then either put it on any of your mucous membranes, eyes, nose, mouth. I mean, a lot of people don't realize that a lot of people catch colds via rubbing their eyes.
Sure.
Yeah, just that's the portal for the virus. So, yeah, masks are useful, and like I said, I've been using them before, because I'm a junior prepper, and I had N95 masks already in stock, and we were using them long before this all.
Now, an N95 mask was said to be much more effective at preventing you getting it, as well as you sneezing on someone else. So the filtrations and the mechanisms were better.
It's supposed to filter out exactly that 95% of particulates and stuff. So
right. Okay. All right. In your opinion, as now. Because he goes on to talk about it's inconceivable that we have a trust issue. It's so difficult that we've become anti-science and all that. We've had this situation with the WHO and the Chinese government and CDC and now Fauci, where there's been a lot of back and forth over things that are, to me, are beyond the scope of just learning. You mentioned learning, which I totally understand. I was the one that was we need to be much more cautious and shutting down, slowing things down. February and March, we really didn't know much, gather data. Now we've learned a ton. We know a lot. where are we now on? Because all the news that we hear is just that there's so many more cases. Testing's through the roof. A lot of cases. A lot of the cases here in Florida. DeSantis spoke yesterday, talked about most of these age ranges for most people were in the 30s and 40s. Right. They were below 50, so they are very low risk depending on what other health complications they have. So therefore, there's really not an area of concern. Even the death projections that I've seen in the capacity of ICU bed graphs, again, go to worldometers.info. There's graphs for this. It doesn't even project changes in that bump anytime soon. Am I hitting the bullseye so far? I mean, where am I? Am I off base anywhere yet?
No, I personally am not surprised. I mean, the numbers just came out for Friday. We went over 4,000 in one day, so that's a one-day record. Am I surprised? No. I mean, I go out, I use my mask. A lot of people are not. So yeah, that's and the fact that the numbers are dropping as far as the age range, again, not surprising, because when I go to the stores and stuff, it's typically old farts like me that are wearing the mask, and it's not the young people. So I think it was prudent for Jane Castor to, though I don't like the word mandate, but that's what it was, mandating masks in businesses. Because we do need to get this down, because right now I have to be that much more careful about being around my mother.
Sure.
Right. I mean, there's just a
you're at a higher risk of carrying it and then giving it to someone who could be vulnerable.
Just because it's circulating right now more than it was a few weeks ago.
Right.
I don't think people are really on Reddit and stuff like that. They're really down on DeSantis right now, and I don't know if that's fair.
But my issue is, and I go back to this, because it's still a social distance or wear a mask. There's still an or pretty much in a lot of the recommendations. Like if I'm not near anybody, physically near anybody, what is it if I am so I saw a video of protesting yesterday, and in this image they all had masks, but they were literally standing shoulder to shoulder. Where are we at on the risk factor for, I got a mask, so I'm okay to just do whatever I want to do?
That's not ideal either, just because of what we talked about, that yes, the droplets could still leave the mask, and the 6 feet
social distancing. That's very wise and prudent, because droplets aren't going to typically go farther than that. So social distancing is very useful, especially if you're outside or even inside. I mean, we're not social distancing well right now. No, we've considered each other in our circles.
Right.
But if I go to the store, a lot of times I don't have a mask. I literally just don't go near anyone. They have self-checkouts. It's 9 a.m. I even see someone in the aisle. I just either wait for them to move, or I just don't go anywhere near them.
And plus, all these employees should be wearing masks now.
Well, they would be more likely to be sneezing or coughing on something that someone could come right behind them. Yeah. But for me, that almost have to be sneezed or coughed on, because I'm just not around anybody. So I'm just trying to get a scope of, if I'm at a protest or rally, I'm standing next to them where they have a mask on. First, if you're assuming they're wearing it right, and then two, what about any other transmission? Is there any other transmission? I mean, it's not like a bodily fluid transmission. It has to be an internal respiratory transmission, correct?
Right. Like I said, it's sneezes, coughs. A lot of places like churches aren't doing their choirs now, because when you're singing or yelling or whatever, right, that's a concern, because you're going to produce more droplets that are going to spread for a distance. It's part of the concern with what's going on in Oklahoma today. Right? If these people aren't wearing masks in this confined quarters. But I think social distancing and mask use should be used in concert and not dividing them. Now, if I'm walking down the street, I shouldn't worry about any of the above. But it's just this close contact type stuff. Yeah, I mean, I think it's been pretty clear for quite some time now, this is what we should be doing. Yeah, so I mean...
Do you think there's a certain element of let's move along herd immunity? Like there's a positive to this in a certain extent, that getting a whole bunch of 30 and 40-year-olds through their infection process, getting them through their 2 to 3 weeks and their circles and whatever. I mean, is there some benefit? That's what we see in Sweden, right? They just didn't shut down. Everybody gets it. But we don't know antibody results. We don't know how effective that is.
Yeah, I mean, that's the Sweden theory. However, their numbers aren't very high. They just recently did a study, and it's somewhere around 5 to 10% herd immunity.
That's it, huh?
To get this under control according to Mike Osterholm from CIDRAP, it should be about 60 to 70%.
I'm going to say 60% is what I've heard.
It's got to be pretty high. So we're not even close. And the other concern is, of course, is how much immunity is conferred by these antibodies. They just did a study this week also saying that it's maybe only 2 or 3 months worth of immunity. So
at some point, though,
it's short-lived.
But that again, so at that point, you become a generation of people that are going to become very just bitter and jaded. They're not going to wear masks every single day forever now, just because this is out there, and it's just not. It's just going to have to go as we basically become into an element where this can become the purge at that point, because there's just no way you're going to tell 300 million people that the immune response is 5%. We got to get to 60 or 70, and during that time, by the way, we have no vaccines, no hopes of that. This thing could have changed, and you're just going to have to wear a mask the whole time and/or social distance. People are just not going to do that. It's just not going to happen.
Well, like I said in previous news talks, it's going to be with us a while.
Yeah, it's not going away.
Get used to us.
This wasn't really a surprise, right? I don't know. Do you consider this a second wave?
No.
Okay. Do you think that this is just a precursor to? I mean, obviously, if we had 3,000, we had 4,000 yesterday here in Florida. Will we not? Do we just not know, or we find out in a week, or are we just? This is how it's going to be for a while. We're going to have thousands of people getting it. The death rates still don't look like it's going to change a whole lot, because it seems to be much more concentrated in nursing homes, assisted living, those kind of populations.
Something we talked about previously.
We did talk about. Mm-hmm. So these two variables really are almost like running independent of one another, in that the infection from that 3,000 to 4,000 into that pocket, it's not moving that number very much. Mm-hmm. And therefore, we're going to see this during the summer. We have a whole lot of cases regularly. The death is pretty flat, maybe see a little bit of an uptick, but it's manageable by the hospital. We're nowhere near capacities.
Right.
And that heads into the fall, where we traditionally have a worse flu season, more vulnerability to weather changes, things like that. That's pretty much, nothing's really changed, right?
No. I mean,
the flattening of the curve gave us more information, made us assess medical care, things like that, but nothing else has really changed.
Yeah, and I suspect that we're going to see this 4,000 a day go to 6,000 to whatever number, until people start abiding by common sense. Mm-hmm. I don't know if that's going to happen. It may not. And going back to Fauci, I think there's a lot less trust. But I think he's also being aided and abetted by the media, who never, ever call him out for this stuff.
Yeah, it's been brutal. I'm not particularly thrilled with where we are, because I'm not a big fan of having to wear a mask in Disneyland. I'm not a big fan of having to go to the movie theater, tell me I have to wear masks. For example, I'm just going to buy food. I'm going to walk in a movie theater with my mask on, go to the concession stand, buy my snack, and then I'm going to sit down in my chair, take my mask off, and eat my food. And if you don't like it, then I guess they'll have to give me a fine, or they'll call the police on me, like Jane Castor's Narc line or whatever she installs. That's what the tattletale numbers that she's in place now. Just insane.
Yeah.
I'm not even going to city. Are you in city of Tampa?
Yeah, I am.
Oh, crap, man. I
work in the city of Tampa.
Yeah, because I don't think I'm technically in city of Tampa. I'm on the other line. So for me, I'm not playing in their tattletale universe. It's crazy.
Well, I suspect that Hillsborough County will pick this up soon.
No, it's going to be the thing to do, especially if we have 3,000 to 6,000 cases. People will be like, oh, you're not wearing a mask, and call the hotline on you. I'm like, what are you going to do? I mean, it's what it says. So, all right, folks, tell me what you think.
Yeah.
Tell me how you feel about Fauci. My wife's just fed up with Fauci, man. It only takes so long for her to flip-flop, and I felt like I could see that happening in real time. So for him to not understand where some of this is coming from, I say it's inconceivable. I'll use your own word against you, buddy. It is inconceivable that you can't see what you've done and the damage that you've caused. So tell us what you think. We'd love to hear from you, and we'll do more stuff on this topic and other things here to come.